As many women know, men are particularly bad at admitting when they're wrong, multitasking, and navigating the female anatomy. What's up, everyone? Today we're going to talk about endometriosis because something I came across in my obsession of inflammation after I had a surgery. And one of the biggest things I found was a lot of correlation to the omega-6 and omega-3 ratios, how it correlates to inflammation, but not only in endometriosis, but they saw a correlation between increased cardiovascular disease, arthritis, more severe asthma attacks, ulcerative colitis, and allergies. A lot of other things. In any case, what's the correlation between endometriosis? Well, endometriosis is primarily agreed on that it is a retrograde flow of menstrual blood that has endometrial tissue in it, and therefore those endometrial tissue flow up the fallopian tube outside of the uterus and then implant somewhere in the pelvic region. The interesting thing is that oftentimes there is a 70 to 90% chance that all women could see this, but the instance of endometriosis is only in 10-15% of women. So what could the correlation be? Could it be correlation to lifestyle factors, environment, and genetics? Yes, and we'll dive into a little bit of that. And a hot topic in the discussion of endometriosis is the lack of research and the lack of diagnosis over the past few decades due to many men are in that provider role. Therefore, it gets done diagnosed because, as many women know, men are particularly bad at admitting when they're wrong, multitasking, and navigating the female anatomy. In any case, the role that omega-3 plays in inflammation is pretty substantial, and you can check out the video I made that dives into the panel I did to look at my ratios. But essentially, the short of it is we see a massively unproportionate ratio of omega-6 fatty acids to omega-3 fatty acids. And this is bad because omega-6 fatty acids, primarily derived from seed oils, cause an excess of arachidonic acid, which is a precursor to a more detrimental series of prostaglandins. Anyways, this study talked about how many studies show a strong association between dietary polyunsaturated fatty acids intake and reduced inflammation, and it talks about the vital role of pathogenesis in the endometriosis. PUFAs N3, which is polyunsaturated fat omega-3, especially EPA and DHA, eicosapentaenoic acid, and docosahexaenoic acid, play a major role in immunological response. They suppress genes involved in inflammation and alter cell membrane composition by displacing N6-PUFA, which is omega-6 fatty acids. One of the main reasons or hypotheses that endometriosis occurs and that tissue is able to develop and proliferate or grow outside of the uterus is due to the fact that when you have an instance of higher omega-6s, you create the perfect environment for inflammation and therefore growth for that tissue in that pelvic cavity. So when you increase the amount of omega-3s or beneficial fatty acids, it's been investigated, and this is in animal models and in vitro, so not quite conclusive for humans yet, but it has significantly suppressed the endometrial cell survival. In addition, supplementation with fish oil reduced the development of spontaneous endometriosis associated adhesions, and talks about the EPA or eicosapentaenoic acid supplementation might be a valid strategy in treating endometriosis. It talks about the association between these fatty acids and the risk of developing endometriosis is still unclear because we don't have a lot of human trials in this. It's hard to correlate that. But in any sense, if you follow the line of correlation between you're increasing the amount of inflammation environment by increasing the amount of omega-6s, it would be beneficial to reduce the amount of omega-6s to help fend off endometriosis. And later in the study, they talk about how the dietary omega-6 are the precursors of pro-inflammatory prostaglandins, which prostaglandins are little chemical messengers, but there's different series, and omega-6 is correlated to PG series 2, which is a more aggressive inflammation-inducing prostaglandin, where when you switch that over to a more omega-3 heavy ratio, you get PGE3, which are right here less inflammatory and more resolvin. And that's like more of a rebuild rather than a hammer down inflammation approach. So the PGE3 derived from omega-3 fatty acids has been associated with reduced inflammation and less pain. And there are other studies that show the reduction of pain in women that have endometriosis when they supplement or increase their levels of omega-3 fatty acids. So less pain. On the topic of pain, it's important to understand that when women are going through their menstrual cycle, they're shedding out their uterine lining, which is filled with nutrients, and their body is primarily pushing a lot of their nutrients into there to prepare for a egg to be implanted. So we'll talk about that in a minute. Some of the nutrients you should be aware of that you may be lacking that could increase the amount of menstrual cramping pain and endometrial pain. But one of the bigger, more concerning things is the first line defense for endometrial pain is nonsteroidal anti-inflammatory drugs, or NSAIDs, things like Aleve and ibuprofen. And I did a video on the importance of understanding NSAIDs because they affect women and men's fertility. Specifically to women, this matters very much so in endometriosis because NSAIDs are the first line defense for endometrial pain. And this is important because in this study, they say that the consensus opinion suggests they are reasonable as the first-line treatment for suspected endometriosis. Some other studies showed that there was no benefit to take NSAIDs, but it's important because how it affects fertility. So right around the time of ovulation is oftentimes reported as the most increase of pain in women with endometriosis because estrogen rises and therefore starts the growth of that tissue in the endometrium and then the tissue outside the endometrium, therefore leading to pain. You get a surge of LH and FSH, which is telling the follicles in the ovary to grow. Then one of those follicles in the ovary becomes the dominant follicle. That dominant follicle has an oocyte or an egg inside of it. And for ovulation to happen, that dominant follicle needs to grow via the stimulation of follicle stimulating hormone, and then LH surge helps break that follicle open, releasing that egg into the fallopian tubes, down into the uterus, potentially getting fertilized by a sperm if you're not mad at your husband. But NSAIDs, specifically naproxen, in the trials showed that it inhibited the bursting of that dominant follicle, therefore not releasing the egg up to 75% of the time. So only 25% of women ovulated while they were taking NSAIDs, specifically naproxen, for about 10 days. The fact that the pain usually begins right around ovulation because of those hormones increasing, you're potentially inhibiting the ability for that follicle to burst and therefore reducing the potential for ovulation. So this would be important to know if you do take NSAIDs and are trying to conceive. And the NSAIDs block cyclooxygenase, which is an enzyme that then tells a different cascade of events to let proteolytic enzymes break down the protein and collagen outside the follicle, therefore causing it to burst and release the egg. If you reduce inflammation via omega-3s, you're not going to do that because you're going to have a pain reduction, inflammation reduction, and therefore you won't necessarily have to take the NSAIDs that give the pain relief. What are some of the things you could do? You could do a serum blood test of omega-6 to omega-3 ratio, and typically in the standard American diet, we see an average of a 20-to-1 ratio of omega-6 to omega-3, where it should be a 4-to-1. I did a video on it and dove deep into all the different markers you should look at and what you should get, and it's interesting to say the least if you do suffer with any sort of inflammation, but it helped me significantly to understand this. And then things to consider specifically for women, not only with endometriosis, but in their entire menstrual cycle, they are losing nutrients because they're getting pushed to the uterine lining, and then that is getting shedded if you don't have a fertilized implanted egg. And many people are potentially already deficient in magnesium. And then women that have their menstrual cycle, especially heavy bleeding from endometriosis, could potentially be decreasing their magnesium up to 50% further. And this is important because it is a very powerful, smooth muscle relaxant. When it comes to cramping, if you're extremely deficient in magnesium, that could increase the severity of the cramping. Mind you, there are a lot of different magnesiums out there. I made a video about that too. Go with magnesium glycinate. It's one of the most studied and beneficial and bioavailable ones. Stay away from magnesium oxide because it's just giving you a soft stool. Another big one is iron, because when you have heavy bleeding, you're reducing the amount of iron in your blood, and prenatal vitamins typically have a higher amount of iron in them, but you could potentially be getting anemic, and you're reducing your amounts of iron in the blood, therefore leading to extreme fatigue because iron is the oxygen carrying capacity in your blood. And when you impair oxygen delivery to the tissues, you could potentially then increase the amount of inflammation because they can't get the needed nutrients to those cells. And typically our body is able to manage inflammation, but in today's processed food diet, which is up to 70% of calorie intake for many people, our body can't keep up with that inflammation. So some of the best ways to reduce inflammation and decrease the amount of this inflammation activity in our bodies would be reducing or strictly limiting the amount of omega-6 consumption that we have. And that is removing soybean oil, safflower, canola, rapeseed, which is canola, corn oil, peanut oil. All these oils are omega-6, and if you have them predominantly in your diet, you're going to have a mismatched ratio. Common things to be aware of. These are hidden in a lot of things like mayonnaise and different sauces and dressings. Specifically, a lot of dressings use omega-6 seed oils because they're super cheap. Also, anything fried, any kind of chip or snack, more likely than not has it. Any mixed nuts, trail mix, all that stuff, it's going to be in there. So minimize the amount of processed foods would be beneficial. And when you go out to eat, they're going to more likely than not use these oils in their cooking. You have to consider it's not what you eat, it's what your food eats. So if you're eating any kind of beef or chicken, know that when they're primarily fed a grain diet, that's going to increase the amount of omega-6 in that food content that you're eating. The animal is going to have a larger ratio of omega-6 when it's on a grain-fed diet. So highly suggest local farm would be best, but grass-fed beef is going to have a better ratio of omega-3 to omega-6. And then including things like salmon and mackerel and sardines will increase the amount of omega-3 in your body. And also be cautious of like mercury content and such. Like most of us don't eat that much fish every week. A quality supplement of omega-3 fish oil would be beneficial to increase those. And I talked about that in the video. What you should look out for in the omega-3s, because there's a lot of, again, supplements out there that if you intake a supplement, an omega-3 specifically, that is oxidized, you're going to increase the amount of inflammation, therefore going against what we want out of that supplement. So if you know somebody that has endometriosis or really any other autoimmune disease, share this with them. It's something to consider to look at those ratios to decrease the amount of inflammation in the body. It's been super beneficial for me. And check out the video I did on the omega-6 to omega-3 blood test that I did that deep dives it. And you check out the NSAIDs as well if you're more interested on female and male fertility issues that come with it, alongside of other concerns that you should have, like giving NSAIDs to your kids when they are dehydrated, like when they have diarrhea or they're sick. Like, subscribe, share, check out the blog on solutionstowellness.org, and there's more videos like this to come. See you soon.